Okay, Gana. This is Rick Soup. Giving my, I believe it's my fourth update now. I'd like to thank McGinima for his update as well to the community. I'd also like to thank him for all the work that he's done to help us. I know with the supplies that we were ordering, he was very instrumental in helping us get these supplies, and with the funding that he mentioned that additional funding, he's helping us get those funds, not only for our tribe, but he's also with Treaty 7. He's working very hard and diligently for all of us in this region here. So I'd just like to mention what we're doing, update again, our general plan. Wanted to just go over it. So firstly, the surveillance and monitoring with Department of Health. They continue to monitor the situation, give us daily updates, what's happening. Again, we have no confirmed cases. We know that the virus is in southern Alberta, but we're doing everything that we can to protect our members. So that is part of the prevention and mitigation strategies that we do. If it does come to our community, and we did have a recent case that was mentioned that Department of Health is working with the Flamingo Hotel. They've got rented that facility, so containment and suppression, that's a big part of what they're doing there. Now we have to adapt to the virus because the virus is always evolving. We have to be ready as it evolves. So that's a big part of our strategy too. When we do our meetings, we meet 3 times a week with our essential team of departments, and as well with twice weekly with council. We all discuss the what we're doing, our strategies. At times we might not all agree, but we all eventually come to a coordinated approach to deal with this. Now, with the recent event in terms of the Flamingo Hotel, we've discussed those situations. We are working together, and I want to mention to everyone that we work as a team. If one of our team members might falter or fall, we pick them up and we work together. And we might have to, as my role is the manager, part of my role is to ensure that we're working in a coordinated approach for the safety of our members. So sometimes I might have to push some of our departments or entities, but it's in a respectful way, respectful manner, and we ask that our community know that we are doing these things anytime we see a situation or area that we have to pick up. That's the purpose of our meetings, and that's why we get together and we plan and we adapt, develop new strategies. So I just wanted to mention that because I feel it's important that we let the community know that we are working on these things. So also, it's a natural fear that what we're dealing with, this virus. So we want to ensure that we have the proper procedures, proper protocols, all the safety equipment that's in place to protect our workers and our members. We understand that our population is considered a vulnerable population, and we are therefore taking steps to ensure that we as a community are taking all the precautions to keep our population safe. We ask members to follow these precautions that we have emphasized, and we thank you for doing so. I believe Makinima has mentioned all the major areas that we've been working on recently, so I won't repeat those areas, other than that we are working diligently, even through the weekends. A lot of us are working, and this is for our people, that we want to serve our people and protect our people, and this is something that we do with our hearts. So just with that, I'd like to leave it there. Again, if there's any questions, we have the contact numbers that the communications department has put out, either for if they have symptoms or if they need additional information. Just what the who to call.
8411.
Yeah. Yeah, the 8411, and where's the communications number?
8141.
8141. So those numbers, and any feedback, I welcome any feedback from community members as well, to help us ensure that we're protecting our people, and any additional information that we get is always beneficial to help us in doing our roles. Thank you very much.